All right, guys, we're here in the office. Today I wanted to discuss low back tightness and why stretching your low back might not always be the best solution. So we're going to talk about balancing shear forces anterior and posterior and what that has to do with tension in your low back, what causes it, and how we can prevent it. So to start off, we're going to take a look at the knee. So this is a cross-sectional of the right knee. So think of you looking at my knee standing here on the right side. So talking about balancing shear forces anterior to posterior, the knee is a classic example. So if you ever have an ACL injury, your ACL is going to reduce the amount of anterior shear that your tibia has on the femur. So if you ever injure that, your next line of defense is going to be your hamstring. So your hamstrings attach onto the tibia and retain it just as the ACL. The only difference is active versus inert. So the ACL is more or less inert. The ligament has no contractile force. You can't say, I'm going to contract my ACL. Your hamstrings, on the other hand, have an active force on the tibia. So this model of balancing shear forces anterior to posterior is translatable in your lower back. So here we have, an anterior shear force caused by the quad acting on the tibia, which could be balanced by the ACL. If there's damage, it could also be balanced by the hamstring. So balancing these forces becomes a big part of controlling pain. So if you have an ACL injury, I wouldn't say stretch your hamstrings. I would say strengthen your hamstrings. We need to increase that tensile force of pulling the tibia back onto the femur because the ACL is lacking. So moving this model over to the lumbopelvis. So a lot of people suffer from low back tightness. They say, Doc, how come my low back is tight and should I stretch it? Well, applying this model over here, we have three structures that are sort of inert that resist the anterior translation. So they provide a posterior shear force. And these three inert structures are your annulus fibrosis, so it's the outer cartilaginous border, if you will, of your lumbar disc. They attach end plate to end plate from each vertebra, and they resist an anterior slippage of each vertebra on the adjacent vertebra above and below. Secondly, we're going to have our joint capsules, facet joints, apophyseal joints, whatever you want to call them, articulating joints between lumbar above and below. And lastly, we have our iliolumbar ligament, which attaches our pelvis into our lumbar spine, most notably L5. So it, again, is going to reduce the shear force pulling anteriorly. So those are our three inert, our annulus fibrosis, our joint capsules, and our iliolumbar ligament. So they all provide an inert force in posterior shear. What happens over time is, you blow out a disc, you rupture your annulus fibrosis, you have problems with your articulations, your facets, and then you sprain ligaments in your low back from sitting at your job for 20 years. So what happens is the inert structures break down. Then we call on our active structures to provide this posterior shear. So our main muscle that provides that active posterior shear of our lumbar vertebrae anteriorly is going to be our deep lumbar erectors. Now our deep lumbar erectors have very poor leverage in extending the lumbar spine. What they're really good at is resisting flexion. So when all the inert tissues break down, these lumbar erectors, outlined in red here, are kind of firing on all cylinders because they need to provide a posterior force against an out of balance anterior force. So the anterior shear forces of the lumbopelvis predominate with your hip flexors. So a lot of us sit at work, then go to the gym and try and squat. So our hip flexors are very dominant, very tight. They provide an anterior pull of the lumbar vertebra. On top of that, another issue that people tend to have, I'll draw a belly button in there. Any extra baggage in the front is going to accentuate that lumbar curve, accentuate that anterior shear force forward. So instead of stretching your deep erectors or trying to stretch your low back, much like the hamstring, what we want to do is we actually want to strengthen the low back and reduce the anterior shear force. So try and balance this relationship, this push and pull relationship. So from that, we can deduce that strengthening the low back, trying to maybe trim this down a bit, get yourself a nice six pack there, and then stretching the hip flexors. So don't worry about stretching the tight structure. I want you to strengthen the tight structure and then stretch the anterior structure in the front so we can have a balance that looks a little more something like this. So something a little more equal anterior posterior. That way you won't have to be calling on your active deep erectors to keep your lumbar spine in neutral. So I want you to think of that next time you're in the gym, next time you're at the office, once you get up, walk around. And we want you to think about balancing the low back. Don't just stretch what's tight. I want you to strengthen what's tight and then stretch what's overdone.